Hi, my name is Saeed Dashina. I'm the headache specialist in Boston, Massachusetts. I'm also assistant professor of neurology and anesthesia at Harvard Medical School. Today I'm going to talk about what is medication-overuse headache. Almost all of us have headaches sometimes, tension-type headache or migraine being the most common. Some unfortunately experience gradually worsening headache despite an increasing use of painkillers. Understandably, this may lead to an extremely frustrating situation. On the top of the worsening headache, medication and other strategies that previously helped do not work as well anymore. Everything tried to relieve the headache seems to make it worse. This is the experience of patients who develop medication-overuse headache, or MOH. Though not as common as migraine or tension-type headache, MOH is the most common chronic headache type. The down-going spiral often becomes exceedingly burdensome, also psychologically, and adds to the general burden of the stressful everyday and work life. The situation is difficult for patients to understand. It seems the headache has a little of its own, even if handled in a way that has worked before and often, in a way that has been recommended by the treating physician. How previously well-functioning medication may contribute to the maintenance of headache is indeed difficult to understand, and requires awareness of the process and looking not just at the headache, but also at how the medication is used. Taking one step back and keeping track of how at need painkillers are used is not easy. Patients are often aware of their medication not working as well as before, but still feel that they have to take something. Some are worried about a high medication intake and have even tried to reduce their medication, even resulting in a worsening of headache and thus suggesting the need to continue frequent intake. This behavior has similarity to addiction, though it is not always easy to say if increasing pain is driving the medication use or vice versa. MOH develops in parallel with an increasing sensitivity also for other causes of headache and contributing factors. In addition, general sensitivity to pain often increases in other parts of the body, such as neck, shoulders, back, which may then contribute to the frequent analgesic intake. This phenomenon of increased sensitivity to pain has been demonstrated in a number of studies in patients with MOH, compared to other headaches without medication overuse. The headache characteristics usually change over time as MOH develops. Headaches may be more unrelenting, continuous, and similar to tension-type headaches, rather than more attack-wise severe migraine headache. However, MOH may also develop from episodic tension-type headache, and in some cases, some headache days may become more migraine-like. This emphasizes difficulty in diagnosing the underlying primary headache. There is a clear link between the medication overuse and the headache, demonstrated by the fact that headache usually improves if the patient is able to stop overusing acute painkillers. Unfortunately, an initial worsening of the headache commonly occurs, for many providing proof that they should not stop analgesic intakes. The rebound headache rarely extends over more than a few weeks. Thank you for your attention.